If I asked you to just close your eyes and think of a sound that gives you instant anxiety, what would it be?
Oh, I think I know where you're going with this.
For millions of us, it's that high-pitched, vibrating whine. You know the one, the dental drill.
Yeah. It's the sound that sends shivers down your spine.
It really is. And it's the reason so many people just run in the opposite direction from necessary healthcare.
It's the universal avoidance trigger. I mean, the data we pulled for this deep dive, it just confirms how powerful that trigger is. That sound, that sensation, it's the single biggest factor causing people to postpone or just outright skip dental care.
Which creates this massive public health issue, and it's all based on fear.
Exactly. On fear alone.
And that's why our mission today is to explore this really fascinating, maybe even revolutionary change happening in dental practices right now.
A huge change.
We're asking the big question, is the dental drill obsolete? We're diving deep into the world of laser dentistry, this idea of using light energy and water to completely replace the friction and grinding for so many procedures.
It's a true paradigm shift. We're not talking about small tweaks to old equipment. This is a whole new philosophy. They're calling it no drill or minimally invasive dentistry.
A new philosophy. I like that.
And the sources we've looked at, they all highlight this as part of a much bigger technological movement that is aimed squarely at patient comfort, at eliminating that fear.
So it's using physics to solve a psychological problem.
That's a perfect way to put it.
Exactly. We pulled a stack of reports and case studies for you today that explore this new era of dental care. We're going to get into the mechanics, the cool science behind how light can cut a tooth without heat, and then we'll get into the really life-changing practical benefits for anyone who just dreads that chair. Okay, so let's start at the beginning. The drill. If the dental drill is the root of the problem, what is it actually doing inside your mouth that causes all that pain and anxiety? It can't just be the noise.
Not at all, no. The noise is just the soundtrack. The discomfort itself is rooted in the physical action. I mean, a drill is a high-speed, abrasive tool.
It's basically grinding away, right?
Yeah. It's using friction and grinding to shear away the decayed part of the tooth. And when you create that much friction in such a tiny space, you get three main painful side effects.
Okay, let me guess. Heat, vibration, and just that awful rattling feeling in your skull.
You nailed it. Precisely. The friction generates this intense heat, and that heat, even for a split second, it irritates the nerve inside the tooth. That's the sharp pain.
Right.
Then you have the vibration, which travels right through your jawbone. That's the deeply unsettling part. And finally, the sheer mechanical force of it can cause tiny little microfractures in the healthy enamel around the decay.
Wow, so you're actually potentially damaging the good part of the tooth just to get to the bad part.
It can compromise the tooth's long-term integrity, yes. It sounds pretty primitive when you lay it all out like that.
It really does, especially when you compare it to what's possible now.
And that's where laser dentistry comes in. It just bypasses all of those issues by using a completely different mechanism, a different set of physics.
Okay, so walk us through the mechanics. How can a beam of concentrated light remove hard tooth decay without heat or vibration? That just sounds like science fiction.
It really does. But the key is a process called cold cutting.
Cold cutting?
Right. So unlike a drill, the laser isn't grinding anything away. It's using a concentrated beam of light, usually in the infrared spectrum, and it's delivering these incredibly short, high-energy pulses.
Yeah.
But here's the crucial part. That light is combined with a very targeted spray of water.
So it's light and water working together.
Yes. The water molecules inside the tooth, and especially inside the decay, they absorb that laser energy extremely well. So when a pulse of laser light hits that combination of water and decayed tooth, the water just instantly vaporizes.
Instantly vaporized. So you're talking about tiny little explosions on the surface of the decay.
That is exactly what's happening. Each pulse creates a tiny, controlled micro-explosion. The water turns to steam, and it just gently and precisely ablates or vaporizes the decay layer by layer.
And because it's so fast and there's water involved, the heat can't build up.
The heat has no time to build up and transfer to the nerve, so you've just eliminated the friction, the vibration, and the nerve irritation all at once.
That is genuinely fascinating. So you're targeting the water in the tooth, not grinding the hard mineral part itself.
It's the difference between trauma and precision. And this mechanical difference, it leads to what I think is the single most significant, immediate benefit for the patient.
Which is what? The real game changer for someone with high anxiety.
Avoiding the needle.
Oh.
The sources were very clear on this. For small to medium cavities, because the laser is so gentle, so precise, and doesn't create those heat spikes, it actually has a calming sort of analgesic effect on the nerve while it's working.
You're kidding.
Which means many patients don't need an anesthetic injection at all.
That is huge. For so many people, the needle is the real start of the panic. The pinch, the pressure. If you take that away, you've basically won half the battle before you even start.
It's not just a minor improvement. It's a complete psychological reset of the entire dental experience.
Okay, so the science is solid. This cold cutting is a radical departure. Let's move from the lab and into the dentist's chair. What does this actually mean for the person getting the work done? What are the big takeaways?
Well, the practical benefits are what really drives this whole thing forward, for dentists and for patients. When we looked at all the source material, 5 major advantages just kept coming up again and again.
All right, let's start with the most obvious point of relief. The feeling of the work itself.
That would be the complete elimination of vibration. We talked about the mechanics, but you can't overstate the psychological impact of getting rid of it.
The moment the work starts, you're just bracing for that rattling.
Exactly. You're tensed up waiting for it. With the laser, that whole visceral, unsettling experience it vanishes. It's quiet.
It takes the grind out of the whole procedure, which leads perfectly into that second benefit you mentioned. Less need for needles.
Absolutely. Less reliance on anesthesia means less intimidation, less trauma. But think beyond just the fear of the needle itself. Think about the practical inconvenience of being numb.
Ah, the numb face factor.
The numb face factor, that's the third huge practical benefit. If you don't need heavy anesthesia, you get to skip that 3 to 4 hour period where you can't feel your lip, you can't really smile properly.
You can't eat or drink without dribbling on yourself or biting your cheek.
Right. So that's a massive win for anyone trying to squeeze in an appointment on their lunch break or needing to go right back to a meeting. It turns a half-day write-off into a quick stop.
It just gives you your day back immediately.
It restores immediate functionality. And the fourth benefit is, for me, maybe the most important for the long-term health of your teeth. Pinpoint precision.
I found the contrast in the sources really striking on this point.
Mm-hmm.
Tell us why a laser is better for your tooth in the long run.
Okay, so think about a drill bit. It has a fixed size, a fixed diameter. To get to a patch of decay, especially in a tight spot between teeth, a dentist often has to remove a wedge of perfectly healthy tooth structure just to get the drill tip in there.
So it's like unavoidable collateral damage.
Precisely. The drill is forced to remove more than just the rot. But the laser, it's surgically precise. The light pulses are so concentrated, the dentist can remove only the decayed material, following the exact irregular shape of the cavity without touching the healthy white enamel next to it.
So you're preserving more of the natural tooth.
We're maximizing the preservation of natural tooth structure. And that is the ultimate goal for durability. Less structural compromise means a stronger tooth for decades to come.
That makes perfect sense. Now, what about the fifth benefit? This is the one that really crosses over from just comfort into actual long-term health. Sterilization.
This is a critical technical advantage. Because the laser is high-energy light, the sources all confirm that it kills 99.9% of bacteria as it works. A traditional drill simply can't do that.
In fact, you mentioned it can sometimes push bacteria deeper in.
It can. The friction can actually force bacteria deeper into the tooth's microscopic tubules. So with the laser, you're not just clearing out the decay, you're sterilizing the surgical site at the same time.
And the clinical advantage of that is?
It's huge. The sources indicate it leads directly to two things: fillings that are much less likely to fail down the road, and more successful, longer-lasting root canal treatments. You're starting with a virtually sterile foundation, which is a fundamental upgrade in the quality of the work.
We've established that laser dentistry is an amazing replacement for the drill with hard tissue, cavities. But this is where the tech gets even more versatile. The sources we looked at spent a lot of time on the soft tissue applications. Lasers aren't just for teeth, they're incredible for your gums too.
Yes, this is where that term minimally invasive really comes to life. Lasers are so effective on soft tissue because they seal tiny blood vessels and nerve endings instantly as they cut.
Which means?
Minimal bleeding and much less postoperative pain.
Okay, let's talk examples. The first application that came up was aesthetic sculpting. This is for people who feel they have a gummy smile, right?
That's right. When too much gum tissue covers the teeth, it can affect how the smile looks. And historically, fixing that, doing a gum lift, it meant using a scalpel. It often meant stitches. It was a whole procedure with a real recovery time.
A bit daunting.
Very. But now the laser can sculpt that gum line with incredible precision, and it's basically painless. Because of that cauterizing effect we mentioned, there's virtually no bleeding and absolutely no need for stitches. Healing is incredibly fast.
That dramatically simplifies what used to be considered cosmetic surgery.
It really does. Okay, application 2 is a fantastic one for families in pediatric care, dealing with things like tongue ties.
A tongue tie can be a huge issue. It can cause problems with feeding for infants, even speech impediments for older kids.
And the traditional fix involved a scalpel, which is obviously very stressful for a child and for the parent. The sources note that a laser can release that restricted tissue in just a few seconds. And because it's so quick and it seals the site, pain is minimal. The child can often go right back to feeding or speaking with improved function almost immediately. It's fast, it's effective, and it's non-traumatic.
That is a massive upgrade in pediatric care.
Mm.
Okay, and the third application, one I think everyone can relate to, getting immediate relief from canker sores. Mouth ulcers.
Oh, if you've ever had a really persistent, painful canker sore, you know how awful they are. They can hang around for a week or more.
And there's not much you can do about it.
Right. But a quick targeted application of the laser to that sore does two things. First, it instantly zaps the pain by sealing off the exposed nerve endings. And second, it dramatically speeds up the healing process.
So instead of suffering for 7 to 10 days, you might have relief and be healed in, 24 hours?
That's what the sources suggest. It's the difference between just managing an irritation and providing an instant therapeutic intervention. The laser is just an incredibly versatile tool.
When you put all this together, the cold cutting science, the zero vibration, the soft tissue work, it really paints a picture of dental care that's driven by a philosophy of empathy.
That's the absolute crux of it. The adoption of this technology isn't just about having the newest, shiniest gadget. It's about fundamentally changing the patient experience to fight anxiety, which we know is a major barrier to people getting the care they need.
Our sources highlighted a few practices that really embrace this approach. One specific example they provided was my gentle dentist Arana Hills, led by a Dr. Deepak Parwani. For them, the laser isn't just one tool they have. It seems to be a cornerstone of how they operate.
And you can see they're intentionally choosing technology that fits their mission. When you have a mission statement that talks about providing care in a stress-free and non-judgmental environment, well, you have to invest in the tools that actually minimize pain and fear. The tech has to match the promise.
That brings up a really important question, though, one I'm sure you're thinking about. This sounds very sophisticated. It probably sounds expensive. Do the sources talk about accessibility? Is this kind of gentle dentistry becoming the standard? Or is it still a rare thing?